Peace be to you all. This is Omar Abdul Malik, physician assistant and health educator. Doing my awesome long run in the woods that I love. Beautiful on this humid, rainy day. So I wanted to take this opportunity to talk to you guys about motivation. Some of you have contacted me about just, your reasons for why you think you want to become doctors or physician assistants, and you're kind of going back and forth, feeling guilty if you're motivated by money and prestige. That's not a bad thing. I will say this to you guys as somebody who's been around for a while, that you want to really check yourself with your motivations for doing things, especially when they're arduous things like going to PA school or med school. And I use those two together because we work so close. As a PA, I work so closely with doctors, and they've expressed feelings to me about the way medicine's practiced now, the direction that it's in which it's headed, their loss of autonomy, and the bureaucracy, things like that. And a lot of them, they're getting burned out. They're like, forget this. I should have gone into computers. And I talk not to too many, one or two PAs that are the same. But your motivation is important, because your motivation will drive you when you're tired. Like, I didn't feel like getting up and going on a run today, even though it's my habit. But I looked outside. It was raining a lot heavier than this earlier, and it was dark and cold. So I was like, forget this. But I'm motivated not to be overweight. I'm motivated not to be this kind of stereotypical middle-aged guy with the pot belly and the metabolic syndrome. That's hypertension, high cholesterol, type 2 diabetes, a couple of other things, high BMI. I'm almost 50, and a lot of my, I got people in my cohort are dying. I'm taking care of people in the hospital that are in their 50s. I'm like, I don't want that, and I want to be a good role model for my community, my kids. But enough about me. With you guys that are questioning your motivation for going into the healthcare field, know that that's not a bad thing. You always want to kind of figure out, why are you doing something. I'll tell you, things that don't last that long in terms of motivation, if your impetus for doing something is money, in terms of going into the healthcare field, know that the money is subject to wide fluctuations, and your lifestyle may change. So let's say you're a 25-year-old person who went to PA school, and you got a couple of years experience under your belt. You're basically running an ER, you're the lead PA somewhere. You're making, let's say, $120 a year. That's good money for a 25-year-old person. But you're by yourself. You live in your one-bedroom apartment. You go out, a few times. You go to the movies when you want. But then, let's say you get married, okay? Then you're trying to add your spouse's money on there, but they get sick. Or you got a couple of kids, then they get sick or something. Or there's cutbacks at your job, but or something like that. Or the dynamic of the healthcare administration is such that there's the $120,000 that you used to earn is now not that much. Your malpractice insurance may go up or something like that. You never know about these things. There was a time with my first job. I think my first job was in 2000 as a PA working in a small clinic, grant funded. $56,000 a year. Man, I was psyched up. I went home to my wife. I was like, they would have paid me $56,000 a year. Oh, that's awesome. That's incredible. That's the most money I'd ever made because I was working as a nursing assistant. But, you know, after a few kids and living in DC, I couldn't live off of that. There's no way. So what was a lot of money suddenly became not that much money. So your impetus of this money can change. If you're doing things out of anger, you know, I can tell you again from experience, having anger as your overriding factor, your main drive for doing something, that gets very exhausting. You know, you can be, you know, when you win something, you become this arrogant person. That's right, I got the A on the exam, I got the highest grade. You start becoming a braggart. When other people succeed, you start to look at them, how come that guy's getting all the A's? That's not fair. You know, you become a doctor or a PA, they're not respecting you. You're always angry. You know, you become a miserable person to be around. And, these rackets. So you don't know that having anger as your main impetus for embarking on a healthcare field, that might not last, and the money might not last. Try to have altruistic, you know, as altruistic as possible factors that you want to work into your main motivator. So you want to help people. That sounds trite, but that's a very good reason for wanting to do things. You know, you want to, you want to educate people. You want to leave behind some kind of positive legacy. So long after you're gone, maybe there's a clinic that you helped establish, or maybe, you know, people in your community have started embarking upon healthier lifestyles, better eating habits, you know, or they have a better understanding of their various pathologies with which they are afflicted. So these are good things, because you're going to get asked this when you go to your interviews. For those of you all who are fortunate enough to get interviewed for whatever program you're trying to get into, whether it's nursing or PA school or med school, so you want to have well thought out answers for that. I had a doctor I met many years ago. She said, you know, I became a doctor because it's the great equalizer, and I'm a black woman, and you know, when you say doctor, the white man's got to respect you. And I said, wow, is that what you tell people? Is that how you approach people? You know, I don't know if that's the healthiest dynamic to have with people, that you're doing something to throw in their face, you know, in the hopes or in demands that you will garner their respect. I don't think that's something that's going to really last. It's going to burn you out. People will avoid you. Maybe they'll avoid messing with you, but not because they necessarily fear you, but because they just don't want to be around you. But you know, you got to have good reasons for going into this field, man. It's no joke. You know, there's times when I'm so tired at work. I work 12-hour shifts. I got to meet with family members. You know, I had a couple of deaths last week. I had to declare people dead. They were do not resuscitate, or we ran a code and the person died anyway. Then I had to talk to the family members. That's a difficult thing to do, you know, every single week. But you know, as a hospitalist PA, I love what I do because I think that I kind of provide that kind of understanding. I've lost loved ones. It's very hurtful. So I'll sit with them as they're crying, or just listen to them quietly as they're raging. Why didn't you all do something? Why did he have to die? in my mind, I may be thinking, well, he died because he was 92 years old with CHF and an ejection fraction of 10%, and metastatic carcinoma. That's why he died. You know, running the code wasn't going to help. But sometimes people just need to vent, and I become the person, I become the one, I'm on the receiving end of their ire. But I can take it. You know, running in the rain toughens me. But that's my motivation, to just help kind of ease people's lives through this kind of experience called life. It's not easy. Look at that. I ran up that hill. Good morning, how you doing? Good. It's awesome seeing other people out here. But I ramble on enough. I hope this was valuable to you all. Take care. Peace.